So this is fire cupping, and my client has a lot of lower back pain. So what we're going to do is move a lot of stagnation to reduce pain. How's that feel so far?
Feels okay.
Do any of them hurt?
Nope.
Okay, good. So you can see that it pulls skin up into the cup. The darker the skin, the more stagnation. The lighter the skin, not as much stagnation, but her pain is down here on that sacrum area. So I'm going to move chi and blood just for healing. Okay, so this is considered stationary cupping. The cups aren't moving. Now we're going to do sliding cupping. When you do sliding cupping, you want to make sure you don't have a tight suction. You need a very light. It's light, medium, and heavy. So we're going to do a light suction, and the way you get that is to just barely put that there, and the cup should slide easily and effortlessly. What this does is it helps with that hypertonic tissue, it helps with tender points, and it helps soften that tissue. So if it doesn't glide easy like this with lotion on, you definitely have it too hard. It works similar to a gua sha tool because it brings gua is scraping, sha is redness, so it's just another way to do it. But this saves the hands and the fingers, and it also pulls new chi and blood into the area, which creates healing. It reduces individuals' pain level, and it softens the tissue. It softens the spleen, because the spleen is all about the muscle. It nourishes liver yin blood, which is all about the integrity of our ligaments. And it nourishes kidney yin, which again is blood, and yang, because it nourishes bone. It nourishes the marrow that comes up the bone. And so we just do this. Does this hurt at all?
No.
Okay, good. Does it feel good?
Feels good.
Okay, great. And you can see the redness here. Do you feel, with as red as it is, do you feel like it hurts?
It feels like, yeah, there's not a bad hurt, but
Okay.
yeah, you can feel it moving. There's
Okay.
the blood coming to the surface.
And if you do the spine, you definitely don't want to push hard. What I'm doing is just going up and down the spine. Some people say you cannot do that, but my clients love it, and I've never had any negative effects from it. So I'm really working on the spine gently, the Wato Jajis, and our Richter spinae muscles. That's what we're working today. So I'm going to cup, do 7. She has upper shoulder pain and neck pain. I'm going to put smaller cups. They're a little harder to adhere, but they're smaller for the area. You have to be careful, not to set your client's hair on fire. So you really have to practice a lot before you work on clients. Okay, so now what I'm going to do is a little bit of tapotement. I'm going to do it across her shoulders. I'm going to do it through the rhomboid area, the upper trap, the middle trap, down to the lower trap. I like to put a little bit of cloth on there. And then you just want to ask your client, is that too much?
No, that's
feels good. Okay. So I'll do this for probably 3 or 4 minutes. What it's going to do is break up hypertonic tissue. It's going to break up stagnation. So bladder 1 is here. Bladder 2 is here. It comes up the forehead, over, and then it converges a centimeter and a half from the midline. And it comes down. I put some dark spots to show how this bladder channel comes. It's a centimeter and a half from the mid-spine, comes down. This is where we have a lot of sciatic pain. And then it runs down. This point here is bladder 40. It's a command point for the low back. This is bladder 27, 28, 29. These are also points for low back discomfort. And then it comes down, sinew channel, and it goes out through bladder 67 at the base of the baby toe. So it's really important when you have a client, because I'm licensed to do massage and acupuncture, it's important, yes, to needle the points, but also to do a lot of massage through here in the calf area on this bladder channel to, to get a lot of new fresh blood into this area, and also to reduce the pain. Okay, so Sherry, when you came in you had low back pain. A scale of 1 to 10, how painful was it?
It was a 10 plus. Yeah.
Okay, so we did cupping, we did acupuncture, we did massage, we did the TDP lamp, and how do you feel now?
Now I have a pain level of about 2 and I feel wonderful. I can put my shoes on without cringing.
Okay, so it's really important once you have low back pain, sciatic pain, once you have your treatment you feel so good, but the real key is not to go clean your house, do yard work, start loading a truck. You have to give your back, your muscles, a good 3 to 5 days rest.
And I didn't, so that's why I had to come back.
Okay.